You can just leave it. Here's some.
And I'm a fourth-year student at the University of Minnesota. Today I'll be presenting on my study on pressure diffusion over the point of the elbow using commercially available elbow pads. There are no conflicts of interest. Hygromas, pressure sores, and abrading surgical sites can develop from repeated trauma to bony prominences, such as the olecranon or the point of the elbow. Conservative treatment for this issue includes the use of thick, soft bedding to diffuse pressure over the point of the elbow. Owners have also taken it into their hands to peruse the internet to find ways to help with these elbow issues at home. Popular commercially available elbow pads have many 5-star reviews that claim to reduce the pressure over the elbow, but there are no current studies that support these claims. These commercial elbow pads have padding that should disperse the pressure over the olecranon and theoretically reduce the incidence of wounds. They're advertised to reduce pain, inflammation, and help with wound healing, as well as speed up surgical recovery. They also claim to help with various elbow conditions. The first step to assessing these claims would be to determine if the elbow pads do in fact decrease pressure over the olecranon. The purpose of the study was to determine if 2 popular elbow pads decreased pressure over the olecranon when the dogs were in a sphinx position as advertised, and if so, is one pad better than the other. We selected 2 brands, the Neo Ali and the Harikashi elbow pads, based on the Amazon customer reviews, as well as combined retail sale of the pad at Chewy.com and in pet stores. Our hypothesis was that the Neo Ali elbow pads would significantly reduce pressure over the elbow, but the Harikashi pads would not. This was based on visualization and feeling of the 2 elbow pads, as the Harikashi pads were much thinner and very compressible, while the Neo Ali pads were much thicker. 12 VMC staff dogs were utilized in this study, and a sample size of 12 dogs was calculated using previous sub-bandage pressure measurements with the same sensors. Each dog weighed over 30 kilograms and was tolerant of minimal restraint. Ease of application and fit of each elbow on each dog was also recorded, and measurements of their elbow cuff, and their length, as well as their chest, was also taken to ensure that we would make sure that they were getting the right size. The pressure sensors were calibrated using a known weight and then partially cut into strips to contour around the point of the elbow. Once the best fit was determined, the strips were taped into place using porous tape. Then the sensors were carefully wrapped onto each dog's elbow to prevent a strapping effect, and a piece of tape was placed proximal and distal to the elbow. Whether we measured the right or the left elbow was determined by random generator. The dogs were then positioned into lateral recumbency with their measuring leg on top, and the pressures over the sensors were measured for 3 seconds. The dogs were then placed into sphinx position, as you can see, and the pressures were recorded over another 3-second period. This set was repeated 2 more times, once with the Neo Ali elbow pads, and then another with the Harikashi elbow pads. Once the elbow pads were on, we visually inspected to ensure the pressure sensors were in the same relative area before recording the pressures over that 3-second interval. The average age of the dogs that participated in this study was 6 years old, with a mean of about 35 kilograms and a 5 out of 9 body condition score. On average, the pressure measured without the bandage was higher than with the Neo Ali elbow pads. However, it was lower than with the Harikashi elbow pads. Ease of application and fit for each dog and each elbow pad was also recorded, and it showed that overall the Neo Ali elbow pad was easier to put on and had a better fit than the Harikashi elbow pads. This graph is an example of one individual dog that relates the peak pressures over time with no elbow pads, with the Neo Ali elbow pads, and with the Harikashi elbow pads. As you can see, when the dogs had the Harikashi elbow pads on, they had a higher peak pressure than when they didn't have any elbow pads on. And conversely, when the Neo Ali elbow pads were on, the peak pressures measured were lower than without any elbow pads. You can also see within each individual dogs, there was a significant amount of variation in pressure with these three variables. This next graph relates the peak pressures of each dog by each variable, so whether they had an elbow pad or the Neo-Ali pad or the Harikashi elbow pad. With the Harikashi elbow pads, there were only 4 dogs that measured lower pressures compared to when there weren't any elbow pads. In general, the Neo-Ali elbow pads had a lower peak pressure than if no elbow pads were used, except in these 3 dogs. The p-value for the Neo-Ali pad was calculated to be 0.02 and 0.19 for the Harikashi pads. Overall, our hypothesis that the Neo-Ali pads would significantly reduce pressure over the olecranon, but the Harikashi pads would not, was supported. While the Neo-Ali pads did significantly decrease pressure over the olecranon over that 3-second period, it may not directly translate to the practicality of these pads. Ease of application was noted for each pad and dog, with the Neo-Ali having a better ease of application. However, putting on the elbow pads on the dogs in general was more difficult than expected, and it wouldn't be great for dogs that are reactive to having their limbs or their paws touched. In addition, because of the short time period the pressures were measured, it's unknown if the Neo-Ali pad would actually be uncomfortable, and so the dogs had less weight on it, leading to a lower peak pressure. And similarly, it's possible that the Harikashi pads were more comfortable, and so they put more pressure on that, leading to an increased pressure. There's also no studies in dogs that quantify the pressure needed to impede blood flow and lead to tissue ischemia and necrosis, which makes it difficult to interpret if these decreases in pressure would actually make a difference over an extended period of time. Due to the unexpected high variation within each dog with the 3 variables, we decided to evaluate the system without variation of the dogs, and we used a 2.3 kilogram system that was loaded 5 times in each condition using that same weight system. These 3 conditions were measured again, and there was some effect at decreasing pressure. It was noted that there was still some variation, but markedly less. Thus, the increase in pressure with the Harikashi elbow pads was most likely dog variation and may have been purposeful due to either temperature differences, laying more forward or backwards based on how the material felt on the elbow. Overall, it's difficult to know if the dogs would actually benefit from the use of the elbow pads without further research using long-term and real-life situations. Some limitations to the study included the small sample size and that the dogs that participated in the study were healthy and non-clinical. Another limitation was the short 3-second interval of the pressures being recorded. The short time frame may not be reflective of how a dog actually orients themselves over a long period of time, especially if they are clinical. It would be ideal to have the dog wear the pressure sensors and elbow pads throughout the day, but it's not feasible with the specific sensors that we use, as they have to be connected to the computer to read the pressures. And there was also a high variation in pressure measurements within the dogs that was difficult to interpret. In conclusion, the Neo-Ali elbow pads may be useful for dogs that have more pressure-sensitive conditions. However, further studies are needed with another model to remove the high variation seen within each dog to be clinically recommended. Thank you to Dr. Gordon Evans, all the VMC staff, their pets, and the Veterinary Orthopedic Society for making this presentation possible.